Hello everyone, today I'm going to discuss to you about the importance of knowing in time when you have a cardiac ailment and you should not ignore your symptoms. There was a 69-year-old gentleman who had major complaints of shortness of breath while walking. He used to attribute it to asthma. He was a poorly controlled diabetic. His major complaint was that even if the AC is running, he used to feel short of breath. Many times he consulted many doctors for asthma. And one fine day, somebody asked him for a stress test. When he was doing a stress test, he collapsed on the treadmill, and his blood pressures dropped. And immediately he was taken for an angiography. And when the angiography was done by the hand, you can see this was a badly calcified 99% blockage in the left main, 99% blockage in the LCX, and 99% blockage in the LAD. So a trifurcation blockage which was there. This is the worst combination to have. This is the precursor of sudden cardiac death. Many times diabetic patients will not have classical angina. They will have something called as an angina equivalent, which could be just shortness of breath. So this patient, when he was taken by a transradial route, there was a 99% blockage all around and he was collapsing, blood pressure was going down. Immediately we wired both the arteries, did the thrombosuction, sucked out the clots. After that, ballooning was done, and this was an intravascular ultrasound which was done following that. After ballooning, we did the stent from left main to the circumflex, and once the stent was deployed from the left main to the circumflex, the plan was to do a provisional T-stent technique wherein we stented the left main to circumflex, and then we went into the LAD, recrossed both the wires, and did a simultaneous kissing balloon technique followed by POTS. And you can see both the balloons getting inflated here at the same time. At this point, the patient was having a lot of pain and a lot of angina, which means we were hitting the right area. And once the stents were deployed, you can see a clear demarcation. LAD is opened up nicely, LCX is opened up nicely, and the left main is also patent. And the patient's blood pressures rose up after that. We did an additional POT to achieve good result. And this was the stent boost technology which we used to see what was the area of demarcation, and the final result was that the VA had a good left main to LAD and left main to circumflex result, and patient was saved in the nick of time. We cannot be as lucky as always. He collapsed here on a treadmill in a hospital. Had he collapsed at home, we would not have been able to save him. It is very heartening to see him now. He comes from Aligarh. He sees us once a month on a close follow-up. In time, please do not ignore your chest pain. Diabetic patients will not have chest pain. They just have shortness of breath, acidity, ghabrahat. So an acidity or a gastritis may not kill you, but heart attack definitely will kill you. A diabetic with shortness of breath is not asthma. Diabetic with shortness of breath is equal to heart disease. Rule out a cardiac problem, and then you think about asthma. Because asthma is a disease of adolescence, not in the age group of 55, 60 or 65. Thank you.